The Walton Centre in Liverpool is a leading hospital for neurology and neurosurgery. Our world-class teams offer exceptional services for diagnosing and treating brain and spine conditions. This short film is about an awake craniotomy, a specialised procedure for treating brain tumours. A craniotomy involves creating a temporary opening in the skull to access the brain. An awake craniotomy is when the patient remains conscious during parts of this type of procedure. This approach is recommended when a brain tumour is near areas controlling speech, language, or movement, as it allows a surgical team to monitor these functions during the operation. The procedure is not painful, and patients are unaware of the surgeon touching their brain. Before surgery, you'll meet with your surgeon and oncology nurse to discuss details and ask any questions.
So today we're going to talk through your procedure that you're going to have. And so the tumour, which we're looking at here, is in the left side of the brain, in this area in the temporal lobe. And that's an area of the brain, particularly for someone like yourself who's right-handed, which is really important for language. And so that's why we're going to do an awake surgery in order to try and take out as much of the tumour as we can, and without damaging any of those areas that are important for speech and language.
You'll also have a preoperative assessment, including blood tests and a consultation with an experienced anaesthetist to discuss sedation and pain relief.
So I'm just going to take you through some of the pictures, and this is to get a baseline of how you're functioning now before the surgery.
Additionally, you'll meet with either a speech and language therapist or a neuropsychologist who will support you during the operation.
This is what we'll be showing you in the operation. So if you say this is a door, okay?
Yeah. This is a shoe. This is a chair. This is a spider. This is a ruler.
On the day of surgery, you'll check in at Jefferson Ward and be escorted to the preoperative area.
Hi, welcome to Jefferson Ward. In this way.
You'll be reviewed by the surgeon and anaesthetist who'll perform last-minute checks, for example, asking your name, date of birth and other details to ensure nothing has changed prior to surgery.
And then if you could just pop these on for me, okay?
Once all necessary checks are completed, you will be moved through to theatre. This is what the theatre will look like. The surgical team may be involved in setting up equipment. Throughout this preparation period and during the procedure itself, you'll be able to speak to the team and ask any questions you might have. If you experience any pain or discomfort at any point, please don't hesitate to inform us immediately.
You're going to put some monitoring on now, okay? And then I'm going to put a small needle in the back of your hand, okay? I'm a consultant anaesthetist here at the Walton Centre. My role is to ensure that you are comfortable, awake, and cooperative during your procedure. There are different options of anesthesia available for your surgery, which are local anesthesia only, sedation, or general anesthesia. This is something we will have discussed during your preoperative appointment to determine which option is best for you during surgery. If you're staying awake for the whole operation, I will insert a drip into your arm and may give you mild sedation drugs to help you feel relaxed and comfortable. If you're having a sleep-awake asleep surgery, I will administer either a deeper level of sedation or a full general anesthetic, and you will be asleep when we start the operation, then slowly woken up for majority of the procedure before being sedated or anesthetized again at the end. If you are awake throughout, we will check that you do not feel any pain and will numb your scalp before the procedure begins using a local anesthetic drug. A urinary catheter may be inserted into your bladder to monitor fluid output and to stop you needing the toilet during the surgery. During the procedure, I will be constantly monitoring you and adjusting your sedation as required.
Your head may be secured in a frame to prevent movement during the operation. At times, we will rest it on a headrest. Clear plastic drapes will be attached in front of your head for sterile purposes, but there will always be someone nearby to talk to and answer questions. Although you won't see the surgeon, you can communicate with them throughout.
I'm one of the consultant neurosurgeons at the Walton Centre. I'll perform your operation, supported by my colleagues in theatre. Before your surgery begins, I'll use a neuronavigation system based on your MRI scan to mark out where the incision will be. A small amount of hair will be shaved along the line of the incision before it's cleaned with an antiseptic solution. Some of the people in theatre will include the anaesthetist, scrub nurses, operating department practitioners or ODPs, and psychologists or speech and language therapists. They specialise in assessing your speech and your movement during the surgery.
Drapes now, sister.
When everything's ready, I'll make a cut through the scalp in order to expose the skull. You won't feel this as it will have been numbed with a local anaesthetic. We'll then use a drill to cut out a piece of skull so that we can see and access the brain to do the operation. The drill can be a little bit noisy for a short time, but patients generally don't hear it due to the effects of sedation. Once the brain is exposed, we'll reduce the sedative medications and wake you up. We'll then monitor different parts of the brain using specialised equipment. This will make sure that we protect the parts of the brain that are important for function, like speech and movement, and we only remove the tumour itself.
I'm a neurophysiologist. My role is to monitor your ability to control movement and speech during your operation. Prior to surgery, whilst you are sedated, I may place several small acupuncture-sized needles in your arms and legs. This allows myself and my team to monitor the impact of your surgery on your motor function, which is your movement. I will use a series of precise electrical currents to stimulate parts of your brain, while you are asked to perform specific speech, language, or movement tasks. Whilst you won't feel the current, you may notice changes, for example, errors when saying a word, or feel different sensations in your body.
This is area.
Okay, now another arrow there.
Here.
This does not mean that anything has gone wrong and is nothing to worry about. It means that the part of your brain the surgeon is stimulating is involved in that activity and lets the surgeon know where they can or cannot operate.
I am a speech and language therapist. If I am present during your surgery, my role is to assess your speech and language throughout your procedure. During this part of your operation, I may show you a selection of different images on a screen and ask you to participate in some short assessments of your speech and language.
This is a canary. This is an owl.
Good. This enables your surgeon to identify areas of the brain which control your speech and language and monitor them during the tumour removal stage of your operation. Did you say the whole thing?
Light and dark.
Good.
I'm a neuropsychologist. My role during surgery is to monitor your ability to carry out specific tasks related to brain function during your procedure. This can include language, perception, or other areas of cognitive ability that are relevant to the location of the tumour. During this part of your operation, I may show you images on a screen and ask you to respond to some questions. This enables your surgeon to identify areas of the brain responsible for different functions and monitor them during the tumour removal stage of your operation.
After the different assessments, once we've removed all of the tumour tissue that we safely can, you'll be put back to sleep or the sedation increased whilst we complete the operation. This involves replacing the piece of the skull bone that we removed with some small titanium screws, cleaning and closing the wound with staples or stitches, and then dressing the wound and applying a bandage to the head.
Let's go.
After surgery, you'll be taken to recovery and then to a specialist ward. Most patients feel tired, but can eat, drink, and move around when ready. Pain relief will be provided if needed.
Hi,
Good to see you. How you doing?
I'm good.
Yeah, okay, good. How are you feeling this morning?
Okay. Yeah.
Your surgeon and the ward team will assess you, typically allowing you to go home 1 to 2 days after the operation.
Didn't feel too sick at all, no vomiting, anything like that.
If you experience difficulties with speech, language, or movement, you might stay longer for specialist support. Full recovery usually takes a few weeks. You may experience headaches in the first few days to weeks, manageable with prescribed painkillers. While rest is important, gentle daily exercise like walking is encouraged. Your surgeon will arrange a follow-up appointment about 5 to 10 days after surgery to check your recovery and discuss any biopsy results.
Good to see you back today. So you obviously can see that the wound's healing up really nicely and you've recovered well, which is good.
They will also advise you on further care and answer any other questions that you have. A clinical nurse specialist will be your key contact for ongoing support and advice about your care and recovery. We hope this short film has answered any questions you might have about your awake craniotomy procedure. We understand this can be a worrying time. If you have any questions, please don't hesitate to contact a member of our team. We're here to support you every step of the way.